All right, let's take a look at cognition. Cognition is the ability to think. This is studied, when we look at this, it is going to be studied by psychologists, philosophers, linguists, artificial intelligence scientists, as well as neuroscience scientists. This is all the processes of human thought. Now, this does take a couple of steps. We first have to have sensory input coming into our brain. Our brain then has to process this information, store it, and then be able to retrieve it to use it later. There's 6 domains when we look at how cognitive function works. We have a motor function, language, learning and memory, social cognition, complex attention, and executive function. Now, this brings us to what we call perception. Perception is the interpretation of all of the environment. So all the information coming in, it's your interpretation, and it's dependent on your sensory input, how you perceive things. Memory is the retention and recall of past experiences and past learning. There's different types of memory. Now, some of this memory is going to be like where you can explain it. It's like a declarative type of memory. Other types of memory are going to be short-term or long-term. So there's many different types. We then have executive function. When we look at executive function, this is the higher thinking processes that allow for flexibility, adaptability, and goal directedness. So this allows you to be flexible when things don't always go, and maybe problem solve and figure things out, as well as being able to adapt to situations and setting goals and moving in that direction. So higher order cognitive function is going to include things like learning, comprehension, insight, problem solving, reasoning, decision making, creativity, and metacognition. On the other hand, the basic order cognitive functions are going to deal more with perception, pattern recognition, and attention. When we move to the impaired cognitive, we see we have mild, moderate, and severe. This is where there's observable and measurable disturbances in one or more of the cognitive processes of that individual. So again, just like we've seen in some of the previous things, there's a continuum that's happening here, where we have this high level on one side and a low level on the other side. Now, when we look at this, cognition is going to develop throughout life. We see some significant developmental times that happen like during infancy and childhood. And this takes place because we have an increased brain mass that's happening, increased neural synaptic connections, so one neuron connecting to another neuron, as well as the increase of the myelination around the axon, that kind of insulation material that helps these neurons send signals a lot quicker, and making this whole idea of processing and sensory information processing and integration happening a lot faster. Now, on the other hand, we do see as we age, the size and weight of the brain decreases, and cognitive impairment does not really get adjusted just to normal aging. When cognitive impairment starts to decline, age can be a contributing factor, but it is not a normal aging process. So let's talk about some altered cognition that we can see here. So the first one here is delirium. Delirium is a state of disturbed consciousness and altered cognition with a rapid onset occurring over hours or a few days. Guys, this causes a dulled awareness of their environment and reduced ability to focus on things. It will affect memory and judgment. Speech may be rapid, more of a rambling type of speech, and even become incoherent where we don't understand it. We'll see emotional swings be part of this, hallucinations, vivid dreams, and delusions. A lot of times, guys, delirium is a complication of hospitalization in the elderly. When they are hospitalized, and especially when they're removed out of kind of their normal setting and their normal routines, we see that it can cause them to go into a kind of delirious type state. We also see some other things that can lead to delirium will be dehydration, electrolyte imbalance, fever, hypoxia, sleep deprivation, adverse effects to medication, and even illicit drug use. Now, usually this is reversible when we talk about delirium with prompt treatment and management of those predisposing conditions that cause it to occur. All right, so now let's talk about dementia. Dementia, guys, when we're looking at it, it's a group of conditions in which the cortical function of the brain is decreased. This impairs cognitive skills and even motor coordination. Issues with memory are common. This includes short-term memory losses as well as confusion of historical events. Behavior and personality changes can interfere with their relationships, their work, and activities of their daily living. There's some particular causes that could be part of this. This includes things like certain vascular diseases, infections, toxins, and there could be a genetic predisposition. If we look at primary, it's not due to another disease. Secondary is due to another disease process. So some primary examples would be things like Alzheimer's. Okay. We also see that it could be due to a secondary issue like a traumatic brain injury. Okay, or HIV infections. Okay, so there's different types of forms. Some other types, like we said, Alzheimer's, but there's also a Creutzfeldt-Jacobs disease and AIDS dementia complex. So let's talk real quick about Alzheimer's. Alzheimer's is the most common form of dementia. The brain tissue degenerates and atrophies. This causes a steady decline in memory and mental abilities. The exact etiology of why Alzheimer's develops is unknown, but they do believe it's associated with three things. First, amyloid plaques mix with a collection of additional proteins. This is going to cause neural remnants and other nerve cell pieces to coagulate together, kind of congregate together. Neurofibril tangles start to take place. These are abnormal collections of proteins called tau that clump together. And connections between neurons responsible for memory and learning are lost. They lose their connections. And guys, neurons cannot survive when their connection to another neuron is lost. A neuron can't live by itself. It has to be connected to other neurons in order to survive. Now remember, when we're talking about this whole idea of altered cognition, it's not actually part of the normal aging process. However, as we age, the risk does increase for this to develop. Rates of Alzheimer's are higher in women. They may be higher in those persons with less education, and that's an unknown reason. We're not really sure why. Additional risk factors include things like a family history, hypertension, hypercholesteremia, diabetes, and a history of traumatic brain injury. Prevalence and mortality rates are on the rise for Alzheimer's, and some complications can occur like infections, injuries, mostly related to falls, malnutrition, dehydration, and development of ulcers. Okay, when we talk about tuberculosis or pressure or ulcers. Now, guys, when we look at this, Alzheimer's has an insidious onset, meaning it's very gradual. It could take its course and it could extend for 10 to 20 years. It includes, again, things like confusion, memory loss, problems with abstract thinking, difficulty finding the right word to express their thoughts or even follow conversations that are going on, difficulty reading and writing, disorientation, even when they're in a familiar type of surrounding, loss of judgment, difficulty performing familiar tasks, personality changes, hallucinations, and incontinence of bowel or bladder control. Now, guys, when we look at this at the very beginning of Alzheimer's, you start to see more short-term memory loss. The second stage deals with more confusion. This is where they become disoriented, lack of insight, decreased hygiene, decreased language. They even can develop what we call sundown syndrome. And the last phase, or the third phase, is the very severe phase, and this is where incontinence comes into play. They lose the ability to recognize friends and family. All right, so this is that progression when we look at Alzheimer's. Now, diagnosis is often difficult because we have to rule out other types of conditions in order to be able to diagnose Alzheimer's. When we look at treatment, though, there's no cure for this, nor are there really any therapies to kind of slow it down. There are some new drugs out there, but there's little evidence that they really work with this across the board with individuals with Alzheimer's. Medications are normally going to be used in order to help with secondary issues like anxiety, depression, sleep disturbances that the patient may deal with. Other things that could maybe help are memory aids, nutritional support, physical exercise, doing cognitive or thinking activities with the patient. Taking safety precautions are important to help prevent falls. Having a more calm and routine type of environment is also helpful for patients like this. And again, having good support. And this support's not just for the patient, but also for the patient. Some other types of dementia, like the Creutzfeldt-Jacobs disease, this one is actually caused by a neuron that's malformed or misfolded. This is related to mad cow disease, and it causes issues, again, with deterioration of the brain. This one actually progresses a lot faster than what we see with Alzheimer's. We also see, when we look at this, AIDS dementia complex. This is when the HIV virus will actually invade the brain tissue. So this is a secondary type of dementia, because the HIV is the actual infection, but it then spreads into the brain. This causes things like encephalitis, behavior changes, and gradual decline in their cognitive function. The next one on her are the intellectual disability. This is limitations of cognitive functioning and below average intelligence. When we look at this, these individuals have a hard time with conceptual skills, social skills, and activities of even daily living. Again, though, it can be on a spectrum from mild all the way to profound. So we have mild, moderate, severe, and profound. A lot of times these are due to like a chromosomal abnormality, like we see with Down syndrome. Down syndrome, they have an extra chromosome 21, which causes and alters their cognitive function. There could be other genetically inherited type of conditions like Fragile X or Tay-Sachs syndrome, which can also affect the cognitive function. And even exposure to certain toxins, malnourishment, and also not getting enough oxygen to the brain could cause these issues. Now, this could be in development of the fetus early on, or it could happen as we age. The next one are learning disabilities. Learning disabilities are impaired cognition in individuals of average or above average intelligence. This is going to go from mild to profound as well, but this is where they have issues or concerns in one or more areas of learning. Okay, they may have an issue with speaking, they may have an issue with listening, reading, writing, math. Okay, we start to see that they have a type of deficiency in being able to understand certain types of learning. So what are risk factors of cognitive issues? Well, advancing age is a risk factor. It's one we can't change. As we age, our risk goes up. It doesn't guarantee we'll have issues, but it does go up. Women tend to have a higher risk. Overall, especially if they have poor health, dependency issues, lack of social support, and insomnia, it increases their risk greatly. Men are going to be at less risk, but their risk still mostly with stroke or diabetes. If they deal with stroke or diabetes, it increases their risk. There's also some pediatric risk factors. These could even be prenatal in the sense of before birth, while the mother is, whether she's taking care of herself or not, it could affect the development of the cognition, the development of the baby, the fetus. Also, there's some post issues like during the childbirth process or things the baby might have been exposed to after birth. Genetic syndromes, toxicity, and metabolic conditions based on the mother, like if she took in some toxins that could affect the baby, or she was exposed to certain illnesses while she was pregnant. It could also be due to metabolism, like if she had gestational diabetes and didn't control that. There's also some maternal diseases as well, like with the mother taking certain medications that could affect the baby, and also events during labor itself. That deals a lot of times with like cerebral palsy. There's not really a genetic predisposition, but due to trauma or issues that happen during the birthing process, it could cause some cognitive issues. We also see that there could be certain behaviors that can put you at a higher risk. This would be things like that may put you in danger for traumatic brain injuries. It's really important that we take safety precautions, if at all possible, to protect our head and our brain, which ultimately also protects our mind in that sense. All right, so chemical exposure, traumatic brain injury to reduce risk. Not putting your seatbelt on just because you don't want to, that's going to increase your risk if you were in an accident. Not wearing a helmet when you were supposed to, all those things are behaviors. Some environmental exposures may be toxic substances like lead or different pesticides. That's one reason why they've kind of like outlawed or banned certain types of like paint or pesticides, because we do know that it creates some issues. There can be congenital and genetic conditions. These could be present at birth. It could be due to the mother not taking care of things properly. These are things like fetal alcohol syndrome, or if the baby had drug exposure and deals with withdrawal. There could be birth injuries like with cerebral palsy, Down syndrome, Fragile X, or PKU, which are genetic disorders, or even Huntington's disease, which is a genetic disorder, but we do not actually see the effects on the cognition until later in life. Now, physical disability and reduced mobility, if we are not moving, because our bodies were created to move, if we are not able to do that, it actually can take a toll mentally on us as well as emotionally. So of course it will affect the mood and affect of the person. It could cause them to develop depression, but it could also decrease their cognitive functions if they're not careful. Some health conditions that could actually also cause risk factors are fluid electrolyte imbalances, systemic or intracranial infections in the brain or through the body systems, fever, pain, hypoglycemia, anoxia, which is not enough oxygen going to the brain or tissues, stroke, cardiovascular disease, pulmonary disease, depression, diabetes, and the list probably could go on and on with this. So with a history guide or for assessment, we want to, of course, take a history. Adults may need caregiver or family members to help them, especially if they're dealing with delirium or a type of dementia. Again, we want to get as much history as possible to help make the best assessment or diagnosis. Examination, we would do a general appearance exam. Are they able to take care of themselves? Is their hygiene okay? We would watch their behaviors, see if we notice any kind of behaviors that are out of the ordinary. We would also then want to do a cognitive function test. When we do a cognitive function test, we're going to ask certain questions or have the patient perform certain tasks. We want to make sure their orientation is correct. They know where they are. They know what they're doing. We would also want to see if they can pay attention, test their memory, their judgment, their insight, their spatial perception, whether they can do certain kinds of calculations, not real hard ones, simple calculations, abstract reasoning, and just also see their general thought process. And those are all part of that cognitive function test, which is actually still part of a greater scale of a neurological exam. All right, so this brings us to management. When we look at management, we have the primary, and guys, there's not really any way to prevent this kind of stuff from happening, but we can try to help by promoting a healthy lifestyle. This is with having an individual have good nutrition, exercise regularly, social activities, regular medical care, avoiding substance abuse, avoiding high-risk type of behaviors that could cause brain traumas, all right? Having healthy pregnancies. So if an individual knows they're pregnant, taking the prenatals like they're supposed to, not taking certain drugs that they know could be harmful to the baby. Genetic counseling could also help. If you are a carrier of a potential genetic disorder or you have family members who have had one, might need genetic counseling in order to see if there's a chance for your child to develop this. Secondary are going to be your screening tests. This is mostly like the mental status screening that would be done just in your primary care type of appointments. But then we also have some treatment. Now, treatment depends on the cause and the onset. Did it happen really quick? Was it over time? What was the actual cause of the cognitive issue? We do see, however, there are some general management strategies that can be used across the board. This is, of course, letting the patient have good rest, making sure they're getting enough sleep, fluid intake is good, nutrition, also making sure pain is under control, comfort, appropriate levels of environmental stimuli. If they are being overstimulated, we want to decrease that if at all possible. Giving the patient predictable routines can be helpful. Consistent caregiving to where it's kind of the same person all the time, where rotation is very limited if at all possible. Simple instructions, eye contact, and also maintaining safety within the home or anywhere they go to again prevent falls, prevent possible injuries and issues. Now, drug-wise, if we look at the drugs or the pharmacology side of this, it is treated mostly. The treatments are going to be mostly associated to the disease. They may help control behavior changes like with sleepiness, anxiety, depression. So they might take certain medications discussed in previous types of videos. We might see that we want to give the medication to help with their agitation. So it just depends on what their symptoms are. Also, family and caregiver support. Now, this is super important. Not only are we supporting the patient, but we need to support the individuals taking care of these patients. This is a hard job. And if you don't believe me, then go be a hospice nurse or be a nurse who is going to work with Alzheimer's patients or the disabled. Okay, when we talk about mentally disabled, because when we look at this, they are going to need help in almost every aspect of their life. Okay, so these caregivers and these family members, they need that support, and they need to understand that what they're doing, if they're doing it right or wrong, and correct it in a loving, caring type of way if need be. Right? That support system can make a huge difference. I know from firsthand experience, because my granny had Alzheimer's. We dealt with it for about 12 years before she passed away. It was a struggle. We were able to keep her home the whole time, however, but my mom and my dad as the primary caregivers, it took a toll on them. Okay, and so getting breaks, having some of us come in and help and things like that was beneficial. So family and caregiving support is super important. The last thing I want to talk about in this particular lecture is psychosis. Psychosis are conditions characterized by a disintegration of one's personality and loss of contact with reality. This obviously does affect their cognition and their problem-solving skills, but what happens is a lot of times they develop delusions, hallucinations, impaired communication, and the inability to deal with life's demands. Okay, and so it causes some major issues here. Now, one of the most common types of psychotic disorders is schizophrenia. Various theories exist on how or why schizophrenia develops. They do believe there is a genetic component behind it. We also see that it could be due to certain kinds of trauma or experiences that may occur. It could also deal with family member or personal relationships. Now, symptoms, when we talk about schizophrenia, this disorder appears in an individual anywhere between the ages of 16 and 25. It is more common in females than in males. Schizophrenics lose touch with reality and act on imagined or fantasized realities. A lot of times they may become very paranoid. They feel like individuals are watching them when they're not really. They may have this idea that they are greater than what they are, like a godlike complex. Okay, they lose connection to that reality. Specific symptoms include, like we just talked about, delusions, hallucinations. They may have a flat tone in their voice where there's no inflection. It's very monotone. Incoherent speech, bizarrely disorganized behavior, lack of speech altogether, unresponsiveness, and even muscular rigidity where they're very rigid. Now, when we look at treatment, guys, treatment a lot of times is going to be with mood stabilizers. These mood stabilizers include things like lithium, but it is very important that they be regulated and watched when they're on medication, because they need to be monitored and medications may need to be adjusted based on how they are responding. Another type of psychosis is a delusional disorders. Delusional disorders are characterized by a firm belief in a delusion in an otherwise normally adjusted and balanced person. This delusion often will center on feelings or perceptions of grandiosity, where they are grander than they are, and they often involve things like romance, religion, or politics. The delusions often develop slowly and involve a false interpretation of an actual occurrence. Okay, so something may have happened, but they're falsely interpreting it and adding details to it that did not occur. There are different types of delusional disorders. There's grandiose. This is an inflated sense of self-worth, power, or knowledge. There's a jealous type, which is the belief that their sexual partner is being unfaithful. Erotomatic, which is a belief that someone of higher status is in love with them. Persecutory, which is seeing suspicious actions or having feelings that people are spying on them. And then somatic, which is the belief they have a physical disease or disorder. Okay, and so sometimes, guys, we see people with schizophrenia may have some of these delusions because that is a symptom with that. However, if a person is relatively healthy and just develops a specific type of delusion, that would be a type of delusional disorder. All right, so this is just a brief look at psychosis. If you have any questions or concerns, please let me know.